Okay, welcome everyone. So I'm just going to share my screen. Thank you all so much for coming. And here we are. Okay, can you see that? Yes, okay, great. So I'm just going to give you a brief overview of our program and what makes it unique. And then I'll have Kim talk a little bit more about the midwifery program. And as Jamie said, then we'll have time for questions at the end. So the program that we have here at Penn is a little bit unique. We do have combined cohorts. So we accept students who are both in the women's health NP track as well as the midwifery track. And those two groups of students participate in the coursework together for the first year. So you'll see here, we start out with primary care clinical, which is where you would be doing clinical work with a primary care provider. That's an important part of women's health care, and it's part of the competencies for the women's health NP practice. Then in the fall, we do what's called Well Woman, which is more of the gynecological care focused coursework. In spring, we do more of the antepartum clinical and fetal evaluation clinical. So those are courses that are focused on the pregnant patient. And then for the nurse practitioner students, they have a final clinical course called integration, which sort of brings everything together for their learning. And at that point, the midwifery track students will also go on and do their interpartum and integration clinicals. And all of the students that are in the midwifery track are also eligible to sit for the WHNP board, so they can be licensed and practice as a women's health nurse practitioner at the end of their program. So you can do this program either in full-time or part-time, and many students choose to do it part-time for various reasons. The full-time program for the women's health track is 14 months. The full-time program for the midwifery track is 18 months. And ignoring the years on these plans of study, you can still see the coursework that's required for each track. And some of these courses are required for all nurse practitioner programs, and some of them are women's health specific. So the ones that are women's health specific are, as we said, the primary care clinical course. There's a complementary and alternative therapies in women's health course that's required, and I'll talk a little bit more about that in a minute. The Well Woman Healthcare clinical and theory course, the fetal evaluation, the public policy is also required, unique course for the women's health program, and then the final clinical and integration. So like I said, you can do this program part-time as well. In this example, these are 2-year plans of studies. You can do it in up to 3 years. And in those situations, people take the non-clinical courses first. So they'll take the pharmacology and pathophysiology, and the non-clinical courses, the complementary alternative medicine course, the policy course, maybe the research course, in their first 1 or 2 years. Oh dear. What happened to it? Hold on. Sorry about that. I don't know what happened to it. It just disappeared. Okay. No, technology. Okay. Can you see that?
Still on the part-time plan of study.
Okay, great, yes. Okay, so in the part-time plan of study, again, this can be done in either a 2 or a 3-year version, and people can choose to do that, particularly if they're working still. Sometimes they'll want to do it part-time or for other reasons. So it is possible to work at least for part of the program. And when Kim talks about the midwifery track, she can give you more details about whether it's possible to work in the last part of the midwifery program. It is challenging for people to work full-time. In fact, it's pretty much impossible for people to work full-time while they're in this program because of the amount of time that's spent in classwork and clinical. So you're expected to be, even if you're doing it part-time, you're expected to be in clinical 2 days a week, as well as in class 1 full day a week. And that's without taking any of the other courses. So it's challenging, plus all the studying and stuff, it's challenging to be in the program and work full-time, but people do work part-time in certain circumstances. So what makes this program unique? We have a couple of courses that are not offered in many, if any, other programs in the country. One of those is the fetal evaluation course, and this is offered in the spring. It's in conjunction with the antepartum course, and this is where you get hands-on experience learning ultrasonography. So we have an entire course devoted to taking care of pregnant people and evaluation of pregnancy, and as part of that we do some ultrasonography content as well as a clinical placement where you get to practice ultrasonography. The other coursework that we have that's unique to this program is the complementary alternative therapies course. And this is a course that's been around for quite some time and is focused really on learning all different kinds of complementary and alternative therapies. So we have practitioners who come from all different modalities, such as Ayurvedic medicine, traditional Chinese medicine, Native American healers, mindfulness meditation, homeopathy and other things like that. And this is a semester-long course where you get to really experience some of these modalities and hear from some leaders in those areas. And then we also have a policy focus in the program. So we feel very strongly that it's important for people to become advocates in the women's health field, especially in this day and time. And so this coursework, we integrate policy and advocacy into all the courses that we offer, but we also have a particular policy requirement for the tracks, excuse me, which covers, policy specific to women's health. And in terms of clinical sites, we do offer clinical sites in a lot of different areas. So we have both private clinics, public clinics. We have sites that are in the community, whether that be in Philadelphia or surrounding suburbs. We also have tertiary care hospital sites, and we have both urban and rural sites. So we place people in a variety of areas within the tri-state region. So we place people in clinicals in Delaware, New Jersey, and Pennsylvania. And it is required that you have a nursing license in all 3 of those states in order to participate in the clinical experience. And we have a group of 6 faculty currently that we share between the programs. And all of us have expertise in different areas, but as a group, we have expertise in all of the components of your training. So we have people that are experts in women's health, in gynecological areas, in STIs, and HIV. We have people who are experts in international care, birth experiences, et cetera. So we try to have faculty that reflect all the different interests that our students have. And we also have a global focus to our program. So we have faculty that run international study abroad courses, which we'll talk about as well in a little bit. We have, one of the other unique things about our program is we do a lot of in-person laboratory simulation training. So we feel that it's very important for students to have experience with their hand skills before they get into the actual clinical arena. So we have in-person labs where we teach you how to do pelvic exams, and we practice on people who are volunteers for that purpose. We have labs doing IUD insertions, which is shown up here on the right, endometrial biopsies, this is colposcopy, and biopsy and suture lab and wet mounts. We train you on all of those things before you actually go into your clinical sites.
For the Hannah, it's still on the plan of study. Not sure if you're advancing.
I am, sorry. Let's see. Okay. Okay. Let me try to bring it back.
I just have to say, while we're waiting for it to come back, it's really nice to see all of your faces.
All right, let's see here. Let me try screen share. Okay. Okay. Okay, can you see the pictures?
Yes.
Okay, yeah, so this was where I was, sorry. Okay, so now for the Women's Health NP track, we do have a requirement that students participate in a professional conference during the course of their program. Traditionally, it's been the National Association of NPs and Women's Health Conference. This is a picture of some students who have gone to a conference several years ago for that. And then, like I said earlier, we do have faculty that teach study abroad courses. So one of our faculty, Mamie Gadera, teaches the study abroad course in Guatemala, shown here on the left. And then we have a study abroad course in Thailand, which some of our students participate in. And that has been taught traditionally by Wendy Grube, and now will be taught by her and me. And then we also have some involvement in West Philadelphia. So we started a couple years ago, we started the West Philadelphia Women's Day, where we bring together community members from the West Philadelphia area, and we host a full day of workshops on various health issues that we have determined were significant from the community input. And we've had workshops for teenagers as well as adult women on topics like menopause and cervical cancer screening and financial management, postpartum care, things like that. All right, and I'm going to turn it over to Kim, who's going to talk a little bit more about the midwifery track.
Okay, I just unmuted myself. So midwifery has been described as an occupation, a spiritual calling, and a profession. And that quote is from Linda Walsh, who actually was one of my professors when I was a student at Penn over 30 years ago. So, and midwifery has certainly existed long before that. I am not one of the founding, members of ACNM. But actually, we're quite proud of the fact that one of our alums, at least from our nursing program, Ruth Lubick, is one of 2 nurses who won the MacArthur Genius Award. And with that award, she founded the Birth Center in DC, Developing Family Center, which is now called the Community of Hope. She's in her 90s, and she is really just a wonderful woman, and she's going to be giving a talk for us virtually for our alumni event that's going to happen in a few weeks. So we're very excited about that. But essentially what Ruth did was bring a lot of midwifery deeply held values to maternity care that was not being practiced in a very woman-friendly way. Back when Ruth was a student, back in the 1950s, women were actually strapped with leather straps to their labor bed, if you can imagine that. So that's kind of like how far we've come. You should visit the ACNM website if you haven't done that yet. It's got a treasure trove of information that can inform you about the profession. Our latest kind of big calling is to try and take a look at ourselves and how structural racism may have been present. It has been present in our profession, and how we can remedy that. So that's a real strong focus right now. Next slide, please. So in the program, your hand skills will be well developed. Of course, everyone thinks midwife, birth, labor and birth, and I have to admit that it absolutely is my most favorite thing in the world to still attend births. You know, I sometimes am so exhausted at the end of 12-hour shifts, but when I've had a good birth during that 12-hour shift, it's actually very energizing. And, you know, I've been a midwife for a long time. As I've just told you, I've taught at several major universities, Villanova, Georgetown, where I was program director for 2 years before coming to Penn. And I've been practicing at Pennsylvania Hospital continuously since 2006. I actually started there in 2003, but took a little time off to finish my doctorate. But since 2006, I've been there continuously. And I was at Georgetown from 2011 to 2013. And I was living in Philadelphia and commuting to Georgetown. And people said to me, you have to give up that clinical job, because that was a second job for me on the weekends. And I'd see patients in the office on Friday morning, and then I'd work either Saturday or Sunday on the labor floor. And I said, no, I can't. That's my lifeblood. That fuels me for every other work that I do. And I mean that sincerely. So if you feel that way about this, Teresa Marsico, who used to be the head of the UMDNJ program, now Rutgers, said before she passed away, you have to love it, because if you didn't love it, they wouldn't pay you enough to do it. And you have to love it that if you were independently wealthy, you'd just do it as volunteer work. So that's kind of where I'm at about that. So I like to share that passion with you. And if you feel that way about midwifery and birth, then I think we're the place for you. Next slide. Okay, so American College of Nurse Midwives annual meeting is where our graduates typically go. In the very center with the striped shirt is Jasmine Perez, and she's actually the only person I know out of that class. That class was before I came to Penn, but Jasmine is a dear and faithful preceptor, and in fact, her practice at Atlantic Care, which is based in Atlantic City, New Jersey, that practice won our Preceptor of the Year award, the entire practice, because they have been a wonderful clinical facility that has partnered with us for our students' clinical work. Next slide. Public policy leadership. So right now, the School of Nursing has suspended our specific public policy course that you find on our website. They're wanting us to merge with a more generic course for the moment. I'm not sure if that's because of COVID. They're trying to consolidate costs, but we would like to see this public policy course resurrected, because it's very focused on women's health and reproductive rights, which we know are absolutely critical to fight for right now. Next slide. We've got 100% pass rates. So I do believe we prepare our graduates very well. Yes. And please join us here at Penn. I'm thinking back to the debate I saw last night where people didn't necessarily answer the question that was asked right when it was asked, but sort of got around to it. At least one of the people did, I should say, and answered most of the questions. So just to sort of twirl back, like Ms. Harris did several times, to a previous slide, actually, I just want to say about the ACNM. This past year was the first time I can remember that we didn't have a live conference. It was virtual this year. And it left a lot to be desired, as the virtual world does. But we still had some very good sessions out of that. And we're not sure in the future, for example, what is going to happen exactly this coming spring. It's usually late spring, end of May, beginning of June, that we have the annual meeting. So we're not sure what's going to happen there, but usually it's really a great time to get together with other midwives. You'll see student midwives from across the country. And this picture, I love this picture. Is that Haja in the front row? You know? Go back, yeah, that picture.
Yes, it is. Mm-hmm.
I thought so. She looks like a fashion model. So I'm pointing the arrow, yeah, you got the arrow. Haja Diallo is one of our newer faculty members. And as you see, she's beautiful and she's also a great teacher. And we're just so very fortunate. I also see, yes, I do know this class very well. And many of these other faces are preceptors for us. And we're always grateful for new preceptors, many of whom are our alums. That was a mouthful. Okay, any more slides? Is that it?
That's it for the slides. So I think Ginny was going to come on and talk a little bit about the oncology minor.
Absolutely. Well, thanks again to everyone for allowing me to join, and certainly want to thank all of the participants in the webinar for your interest in the Penn School of Nursing, and including this absolutely wonderful program in terms of the Women's Health and Nurse Midwifery program. Just a very small little story. Years and years ago, I used to actually share an office space with the Women's Health program. And they truly are just, we have wonderful faculty across the School of Nursing, but the Women's Health faculty has always been incredibly important to me. I've had really strong relationships with many of them for over the years. And so they are an incredible faculty. I really mostly want to kind of talk about minors in general and give you an example of a possible minor, which is the adult oncology minor. I really encourage folks that when you're considering all of your options as you're pursuing graduate level work, is to really look at where a School of Nursing kind of fits in terms of a university setting. And Penn, you know, not to be elitist or anything like that, but Penn really does have, just an incredible wealth of resources and, experts and, just some really, really novel learning opportunities. And the School of Nursing clearly has tried to leverage that and to bring some really very unique minors that are available to the school. So whether or not it's like global health or nursing leadership or administration, technology, forensic medicine, whatever it might be, there's a large number of them. But certainly one to think about would be the adult oncology minor. And so, again, this is a great opportunity for students to add some breadth to their population-based program, as well as some depth to their program. So you might, be, and I do want to say that the oncology minor really is specific for the women's health nurse practitioner students. It really is not applicable to the nurse midwifery students. But this is you might think of yourself as maybe wanting to work in gynecological oncology, or maybe you don't want to be a specialist in oncology, but you realize that many of the women that you're going to be caring for either have risk factors for cancer, or maybe they're undergoing treatments for lots of different types of cancer and you're kind of co-managing their experience, or they will have had cancer. And after their treatment, they're going to need, support with their symptoms, as well as their overall, health promotion. So the adult oncology minor might be something for you to consider. Before I get into the specifics about the course, I do also just want to, whether or not you're looking at this minor or possibly other minors, most of the minors are 3 courses, but you can maybe take like just one course, usually the first course in the minor, just to give you kind of like some intro level content. And so that might be something, if you don't want to think about the entire minor, you might want to take a course or 2 and add it to your curriculum. Next slide, please. So, the oncology minor, again, 3 courses. It starts off with kind of, tumor biology, risk reduction, screening, diagnosis, and then the rest of them have to do a lot more with treatment and the management of various diseases. We do require clinical, but again, just to give you an example about really how wonderful the women's health and midwifery faculty have been for years, is that final clinical, which is in your women's health program, would be your integration clinical. That would be actually done in an oncology setting, focusing on women's health issues. Those students do need to continue their clinical into summer session 2. So women's health students who are taking the oncology minor do extend the length of their program for 6 weeks. And then just a last statement that I wanted to make is that the oncology minor has been offered in a hybrid format, and many of our minors are being offered in a hybrid format, and this was even pre-COVID. So we come together a couple times a year for kind of immersions on campus, but the rest of the content is done via synchronous or asynchronous learning online. We do have a really robust instructional technology department here at the School of Nursing, which has really helped us deliver really high quality online experiences for our students. So again, I don't want to take any more time away from the program faculty and the inquiries, but again, I just encourage you to think about your education, to look at the minors, and to think about whether or not there's something that you might want to partake in, to kind of, again, add some breadth, add some depth, to take advantage of other resources that are available to you at the university. But overall, I just wish you good luck as you kind of go through and pursue all of your options. And if you do proceed with an application here at Penn, again, good luck in that process. Okay, thank you.
Thank you, Jenny. And I would just say that for the people considering the women's health track, that many of our graduates have taken advantage of this oncology minor, and they have had great success in getting jobs and in satisfaction with what they've chosen to do. There's a really, really high demand for people who specialize in oncology, and particularly women's oncology. So if it's something that you're interested in, I would really encourage you to get in touch with Jenny and see if that would work for you.
Great. And I'll put my contact in the chat box, and feel free to, glad to answer any questions that I could help regarding minors as well as the oncology one specifically. Okay, thank you.
Thank you, Jenny and Hannah and Kim. Before we get into our Q&A, I just want to go over our application deadlines. So as Hannah mentioned, you can do the program full-time or part-time. You can also apply, if you're applying for the accelerated BSN, you can apply as a BSN MSN applicant as well. So if you are applying to the accelerated BSN program or the BSN MSN program, that deadline is in 1 week from today, October 15th. The ABSN program follows a fairly traditional decision timeline. Everyone will hear back in mid-February. If you are a current nurse, current RN, or you are in your BSN program applying to the program, you can apply for full-time or part-time. If you are interested in enrolling for this spring, mid-January, you also need to apply by October 15th. If you're interested in applying for full-time enrollment, that deadline is November 2nd. And if you are interested in enrolling part-time, but not until this summer or fall, you have until March 15th, 2021. If anyone here is a current Penn, BSN, or ABSN student applying for submatriculation, if you're a senior, you'll need to apply by November 2nd. And if you're an ABSN student or a junior, you will need to apply by April 1st. On the right-hand corner is the right-hand column, sorry, is the latest notification you'll hear from us. So we have one deadline, but we have a rolling decision process. So you might have colleagues or friends who are also applying to the same program as you. They might hear back 2 weeks after the deadline, while you might not hear back for a month after the deadline. That's because we review many applications and we just work through them as we review them. So we ask for your patience and you'll hear back in these general timelines. And just to promote our other webinars coming up, we have a few more program-specific webinars. This is one of our last ones. If you're interested in another MSN program that we have that's not on the screen, it means that the webinar has already happened, but it is recorded and it is available on this website below. You'll also receive the link when you receive this recording. We also have a general webinar coming up on the accelerated program as well as the graduate program admissions for our DNP programs and our PhD programs as well, if you happen to be interested in any of those. Now we'll get into the Q&A. I just want to say first that we have a little over 90 people on here right now, so I'm sure we have a lot of questions. We ask that you please stick to more general questions. If you have very specific questions about your background or credentials or anything like that, please send us an email. We're happy to work with you offline, but we want to make sure we get to as many people as possible. So we ask that you stick to some more general questions. So with that, if you want to type in the chat box and we will answer them as they come through.
I'll take this one, asking about minors for midwifery. No, those are not available to midwifery because you have a total of 17 courses. And in the summer in which the WHNP students are doing their integration and their minor rotation, if they want to add on 6 weeks, you're going all through the summer anyway, learning how to attend birth, suture, perineal lacerations, etc. So you're in that entire summer curriculum with your clinical intrapartum course, and then you still have another semester to go for your integration. So that is why you cannot do a minor if you are in midwifery.
Okay, so there's been a couple questions about gender affirming care, LGBTQ populations and anti-racism training. So we do, the Women's Health program is Women's Health Gender Related Nurse Practitioner program. So the competencies for the Women's Health curriculum now do include taking care of transgender individuals as well as other individuals who don't identify as heterosexual. So we do care for all of those individuals. We have content in every course that addresses healthcare for those individuals. And in terms of the racism, anti-racism, we do incorporate that content into every course. So we have seminars specifically devoted to that. We have projects specifically devoted to it, and we discuss it in pretty much every lecture that's given. And similar with trauma-informed care, we do address trauma-informed care throughout the curriculum. There's not a specific course on it, but it is addressed throughout the curriculum. Is it possible to do both? So if you do the midwifery program, you already are in the women's health program, like you automatically do both. So if you're in midwifery, you get all the content for the women's health program in addition to the content for the midwifery program. Okay.
Do you want me to take one? We can alternate.
Okay.
So yeah, just to segue onto what Hannah just said, you get 1 degree, Master of Science in Nursing. And if you graduate from the midwifery program, you're eligible to take 2 certification exams, the midwifery certification exam as well as the WHNP exam. You've had course curricula that covers the content for both. So I hope that clarifies. We do have clinical experiences with out-of-hospital birth centers. We are responsible for finding your clinical sites. You are not required to find them on your own. That said, I will tell you that we have 0 slots available for full-time students to be admitted this coming year. Okay, we don't have clinical sites available, and if you look on the ACNM website, midwife.org, there's probably going to be something up there about nationwide. There is a real crisis in getting clinical sites. COVID has totally exacerbated this. And what they describe is what's essentially happening here is that you have overlapping cohorts in clinical at the same time. We have students that were due to graduate in August that are still have not graduated, and that's for women's health nurse practitioner. For midwifery, our students that are due to graduate in December, some will graduate in December, some may not graduate until May, and that's if COVID does not shut down clinical sites like they did in March and April. Our students who are currently enrolled in what we call the second years, they're doing that last semester of didactic. Some of them are still completing their basic intrapartum. Our first year students are rotating between primary care and well woman rotations because we don't have enough sites for all of them to get both of those done in the usual amount of time. So that's what's happening right now on the ground. And that's why we don't have any full-time openings for this coming fall. But if you're interested in part-time, hopefully in another year or so, that will be straightened out. I don't know, I don't have a crystal ball.
I can answer some of the admissions questions. Sorry, Hannah, if you had anything.
Okay. I was just going to say there's been just a couple questions about abortion. So we do cover abortion care in the curriculum. You are not, as a women's health NP or midwife, allowed to perform abortions in the state of Pennsylvania. So there is no ability to do that, clinically. Some people do a couple days in an abortion clinic as a clinical placement just to observe. But again, there's no actual practice of abortion that's legally allowed in the state of Pennsylvania or New Jersey or Delaware.
So for some admissions questions, there's a question about prerequisites. If you're applying to the accelerated BSN MSN program, so you're not currently a nurse, but would like to become one eventually in NP or midwife, there are specific prerequisites you need to take: nutrition, biology, microbiology, A&P. All of those courses are on the website. If you are currently a nurse, you just need your BSN or entry-level nursing degree. So you might have a direct entry MSN and an introductory statistics course that can be at the undergraduate level. So question for students attending full-time, how do they financially support themselves? Many students do take out loans. We do have some money for some merit-based fellowships for full-time students that either come through once you are admitted. We also receive money throughout the year. There's also opportunities for external scholarships as well. There's some information listed on our website. And I found it. There's a question about for recommendations. Can you clarify whether a form is sent to our recommenders or do they attach a letter? Can you speak about the types of references you're looking for? So in our application system, you just put in your recommenders information, their name, email, title, so on and so forth. A form gets emailed to them and they upload the letter within the form. So it's all done electronically. We like to see a mix of academic and professional references. You need to submit 3 recommendations, but you can submit up to 5. You don't get extra points for submitting up to 5. That's just for your benefit. We want to see people who can comment on your ability to perform in a rigorous academic environment and to speak on the skills that would make you an excellent advanced practice nurse, no matter what program that you're applying for. If you're entering Penn through the accelerated program, can you extend straight into a DNP program? We do have a postmaster's DNP, so as the name implies, you do have to have an MSN degree. So once you have completed or you're enrolled in the MSN program, you can apply to our postmaster's DNP program. Perhaps by the time you apply and enroll, there might be some sort of bridge program, but right now you do need to apply separately. And then lastly, I'll turn it back over to Kim and Hannah. Would you recommend working as an RN for a year or two prior to studying to become an advanced practitioner? Absolutely, yes. Our most competitive applicants have at least a year of work experience, if not more. All of our faculty really promote that you really can't be an advanced practice nurse until you've been a nurse. I can let Kim and Hannah talk more about that but from an admission standpoint, absolutely yes. It strengthens every part of your application.
Yeah, let's see. I think there was a question about research, and there is, as part of the coursework in the programs, there is a research required course. There may be opportunities to participate in research during your actual time in the program. What tends to restrict that is really the amount of time that the program takes in terms of hours of studying and classwork and clinical work. Most students find that they don't have time to participate in anything outside of what's required. So it would depend on, if you're doing it part-time, of course you may have more time, but there's a lot of faculty in the School of Nursing who are doing research, and there's a lot of opportunities in general to participate in research, but it would just depend on how you were doing your coursework, whether you personally might have the time or the, sort of energy to participate in something like that within your program.
How about if I segue with that one again? So I agree absolutely with everything that Hannah said. And once you're in the clinical courses, there's usually not a lot of time for you to devote to a research project. I do research on nutrition in pregnancy, particularly in women who are obese or have gestational diabetes. And I'm working currently on a project to try and increase fruit and vegetable intake in low-income populations. So that's an example, just to give you an idea. You can check out my publications if you search my name in PubMed to look at things I've done in the past. What else can I say? There have been several questions rolling through about, let's see here, the admissions stuff I am leaving to you, Jamie, in terms of GRE.
I know.
Someone asked about switching from tracks. So we really discourage people switching tracks between midwifery and women's health. It's really important to think before you apply about which direction you want to go, and they are different roles. So if you have any questions, you're not sure, we're more than happy to talk to you about it beforehand. But we really encourage people to be clear on what direction they want to go from the beginning. It's generally not possible to switch tracks because of the clinical placement challenges that we have. So we accept a certain number of students into each track based on the clinical placements. And so switching tracks would change the clinical placement sort of metrics, and we generally can't do that.
So thank you, Hannah. And you just reminded me to come back to, there were two other questions I wanted to come back to. One is to finish up my last, what I was saying about research. I knew there was something else that I wanted to mention about that. And somebody asked about if you get your master's, do you have to get a DNP first, or can you go right to a PhD? Absolutely, you can actually go from a BSN to PhD at Penn with our Hillman Scholars Program, but that's not the audience I'm talking to right now. But we certainly strongly encourage you, if you are all interested in research, to go for a PhD. We have a dearth of faculty in midwifery with PhDs. There are not that many of us in the entire country, and we need more. We need more midwifery research. And that there was actually just recently an international conference where that was really emphasized, that a lot of the research dollars goes to high-risk care and looking at outcomes of high-risk conditions, all of which is important, but not enough is going to just the provision of basic care and basic healthcare needs and social determinants and how that also affects health. And I'll just take one other one while I have the floor here and then turn it over to you guys. Is relocation necessary? Well, yes and no. Right now at this time, you know, we have been an on-campus program, and our students, the midwifery, for their integration rotation, are able to go far away for that last rotation, which essentially during that rotation, it's you're working in a practice. We've had students go as far away as New Zealand. So we have international students as well, but it's just for that course typically. Right now, we're in a different situation. And as Hannah said, you have to have licenses in all three in the tri-state area, Pennsylvania, New Jersey, and Delaware. And now that's where we place our students. Northern New Jersey is a little difficult because it's Rutgers territory. You know, I have the privilege of belonging to two ACNM affiliates, the Pennsylvania affiliate and the New Jersey. Obviously, I work for Penn, but I live in New Jersey. So I like to keep my pulse on what's going on in New Jersey because South Jersey has traditionally been our clinical territory. Again, this is all, nothing's written in stone, but that's kind of like the way it's been shaking out. So it's a little harder to get North Jersey placements because Rutgers, whose midwifery program is based out of Newark, sees that North Jersey belonging to them. And yeah, so right now, yes, you would have to relocate, but you know, we're sometimes making placements a little further out because of COVID. If people are there, it's everything's up in the air right now with COVID. And we're essentially, you know, one thing I can tell our students is it may take you longer to graduate than what you anticipated because of this crisis. None of us saw this coming. But one thing I can tell you with certainty is we will not let you graduate unless you are competent. Okay, that's not going to change. We'll keep you here longer. And the way Penn is actually handling that is that the students will not be charged any additional tuition. For example, those students of mine who were supposed to be graduating in December who are not going to graduate till May, they're not going to be charged additional tuition because they have to extend into May. So, you know, at least Penn is able to, you know, assist in that way. But I will now shut up and let you guys talk.
I can answer some more admissions questions on the topic of tuition. I think there was a question earlier about full-time versus part-time. It's pretty much the same cost. It's by course, and that information is on our website. Summer courses are slightly less expensive than fall and spring courses, but it's by the cost. So there's no, I mean, it depends on how you do it. Maybe when you're part-time, you try and take certain classes so you can take advantage of tuition benefits through your employer, but otherwise it's pretty much the same exact cost. There's a question for our accelerated applicants. Do you have any general advice for what to highlight in the personal statement and video interview? So the two can overlap. We understand they're asking many of the similar questions, but we're really interested as a non-nurse. Why are you interested in becoming a nurse? And specifically, if you're applying for the MSN program, why are you interested in this specific population and advanced practice area? And we don't expect you to have a 5 or 10 year or even 1 year plan completely mapped out, but we really are interested in your goals and what you hope to do with this program after graduation. I am just scrolling through. There was a question about GRE and TOEFL scores. If you do need to take the GRE or the TOEFL, you do need to submit your scores by the deadline. There was a question about some matriculation if for other current BSN and ABSN students at Penn Nursing. The benefit is that you can take graduate level courses as a current BSN or ABSN student that will count towards your MSN degree. Then you can go out and work and you have a spot guaranteed for you. You do need to complete your degree within 5 years of graduation, and you will talk with the faculty members of whatever program you're applying to about your plans for working and when you'd like to come back. On that similar note, do many of the ABSN MSN students take a year break between the programs? Same thing applies. You have 5 years to complete your MSN program from graduation. So a lot of our students do take a break. Is there a place on the application to indicate you're interested in a research fellowship? There's not a specific question. However, you could talk about your research interests in your personal statement. And given that it is always better to have work experience, how should we approach the accelerated option? Do you recommend becoming a nurse first and going straight to the master's, skipping the accelerated program? No, not necessarily. What we recommend is in between the accelerated and master's program that you get some RN work experience. We obviously can't have RN work experience if you're not a nurse. For our accelerated students, we're looking more for their interest in healthcare and their experience in healthcare, but we recommend in between the programs, go get some work experience. And I think I've covered, there's a lot in here. So Hannah and Kim, if there's anything you see that we haven't.
Someone asked, is it possible to do research after finishing the program? And yes, absolutely, either as a bachelor's prepared nurse or a master's prepared nurse. Research is definitely an area that you can work in. I worked in research for 15 years. So there's plenty of opportunities to work in research. And that's something that's, commonly done for people who are interested. There's a question about midwifery opportunities for study abroad. So there are the study abroad courses that we offer. Those are coursework during the semester, and then there's a 2-week trip to the various countries that you're studying about. So it's not like a whole semester abroad. As Kim mentioned, there are a few opportunities for midwives to do integration clinicals in other countries. So those are the 2 ways that you would do the international work while you were in the program. And there's a question about being able to work part-time. So generally people, if they're going to work part-time while they're in the program. It really depends on whether you're doing the program full-time or part-time. So if you're doing it full-time, you cannot work full-time. That's really not gonna benefit you or your education to try to do all that. And there's literally not enough time in the week to do it. And if you're going part-time, working part-time can definitely work. Once you get to the clinical courses, people generally go down to per diem just because of the scheduling, because there's so many days that are required for classwork and clinical, but it is individual dependent. In the midwifery track, however, once you get to the intrapartum, it's pretty much impossible to work during that time.
There are some questions about enrolling if you're applying to the BSN MSN program with midwifery and how it might affect full-time enrollment. So you can still apply to the BSN MSN program. The accelerated BSN program, we're currently having classes online, but that enrollment is not affected. You can still apply and enroll. We really don't know what the future looks like. If we did, I think I would be doing something else right now, maybe. But we're not quite sure what it's going to look like when you graduate in 2022 or 2023, whenever you decide to apply. hopefully things will be somewhat back on track, but we really can't say. Again, with that said, if you apply to the BSN MSN program, you have 5 years to complete your program from graduation. So you might, you'll probably work a year. You might need to work 2 years for clinical spots to open up, or you might need to do the MSN program part-time instead of full-time in a few years. But we really can't say what will happen, but we do encourage you to still apply to the BSN MSN program, and hopefully things will be on a somewhat regular schedule by the time you graduate from the BSN program.
Yeah, if I could just add, there have been a number of questions. I'm not sure if I was clear when I said it before. We do not have zero full-time openings for midwifery to start next fall. And that's because we are backed up with clinical sites. We have students that you can apply, but I'm going to tell you we'll have 0 acceptances because we don't have any slots. You can apply. What I would suggest if you're direct entry, because we really like our direct entry applicants. And I say that because many of you have great experiences that are able to add to the profession, but part-time, yes, we will have some part-time slots, but we will not have any full-time slots for fall of 2021. We just don't have the clinical sites.
So someone asked, what is direct entry? Direct entry means you already are a nurse and you're applying for the master's program only. So it's not a submatriculation, it's not the APSN, MSN, or BSN, MSN, it's just the master's program straight. You already have your bachelor's in nursing and you already are licensed as an RN.
Yes, and we would encourage you to apply. We love our direct entry students who have nursing experience. And again, you don't have to have it. It's not an absolute requirement. And we've had some very successful students who did not have nursing experience, but overall, all things being equal, experience, whatever you learned working as a nurse in some ways is going to help and affect your practice, I believe.
Okay, so we are a little past 1 and I want to be respectful of everyone's time. Again, if we didn't get to your questions, we know there's a lot. Please feel free to send us an email. I'll put in our admissions email right here, which is admissions@nursing.upenn.edu. That's where all of the emails you've received about this webinar came from, so you can also reply to those. Thank you, everyone. Thank you again to Kim and Hannah and Jenny for your time and valuable information. Good luck to everyone applying, and we look forward to reading your applications.
Thank you all.